The problem of depression during pregnancy. During pregnancy, it's quite difficult for any woman to confront a treatment for clinical depression. This happens because there's a high health risk if one consumes antidepressant medicines during pregnancy. However, by visiting the doctor at the right time and with efforts from the patient's side, this issue can be resolved. Generally, it has been noticed that women are more emotional and sentimental in the initial couple of days of pregnancy. Around 10% pregnant females require antidepressant treatment prescribed by the doctors. However, the percentage is a lot higher than that since females are approached quite softly during pregnancy and this becomes a neglecting psychological illness. Women become more emotional and depressed because of the excessive safety measures and overcautious subjective view taken during the pregnancy. This may result in a serious psychiatric effect on a pregnant woman. There's a high possibility that the antidepressants can hurt the unborn child of a pregnant lady. However, even excessive stress and depression can hurt the infant. Considering these points, it relies upon the seriousness of the illness, the decision of the guardians of a patient, and the recommendation of the doctors. Depression in a pregnant lady can result in developing a few issues for the unborn child. Some issues that a child might develop due to the depression of her mother are irritability, slowness in activities, and less attentiveness. Short growth period is likewise one of these effects. The consumption of antidepressants can result in some major issues such as pulmonary hypertension, weight loss and cardiovascular deformities in the infant. Recognizing depression is exceptionally difficult during pregnancy. For the most part, females end up becoming really emotional, homesick and hyperactive during pregnancy. Extra attention and a few physical changes can make them sad or upset. Sudden mood swings, low vitality are normal signs in every pregnant lady. Those females, who have low clinical depression, can become pregnant. Remember, depression and PCOS, polycystic ovary syndrome, are connected with each other. PCOS is an illness that causes trouble for women who are trying to become pregnant. However, it can be cured by visiting the best doctor for PCOS. While planning for pregnancy, you should stop all types of antidepressant medicines at least 6 months before. You should consult your psychiatrist or gynecologist before starting or stopping any type of medicine. If you've severe clinical depression, there is no point in taking the risk for both child and the mother. In some situations, even serious patients can have kids, however it is quite unsafe. Such women need to be treated with proper medicines, therapies, meetings, and consultations. By and large, it is proposed that those females who are somewhat depressed should stop medicines, and even the individuals who are in medium seriousness level can do so. Visit your psychiatrist and gynecologist to get more info.